Good morning and welcome to the Wednesday edition of the Megacast. My name is Dave Scott. Tyler Keefe is running around the building today. He might pop his head in the studio here briefly, but we will check in with him in a couple of moments as we can. We want to thank you for tuning in. I'll explain what the Megacast is in just a second or two. I'm doing what I always do when I get in here. Who knows who was in the studio last? So we follow the rules we have right here. For those of you watching, our Clorox disinfectant wipes, which we use to wipe down our studio and never flush down the toilet ever, no matter, never, ever, ever. So we're kind of cleaning things up here a little bit, getting all the buttons cleared off and trying to get rid of any of that nasty COVID-19 that might be in here. Thank you for tuning in wherever you happen to be around Oakland County. I want to thank our great radio stations for tuning in today and you joining us via 89.3 WBLD in Orchard Lake, West Bloomfield, Eagle Harbor, Sylvan Lake, 88.1 WBFH, The Biff in Bloomfield Hills, Birmingham, Beverly Hills, Bloomfield Township, Pontiac, and also WAHS 89.5 Avondale Community Radio, transmitter right there at I-75 and M59. And talk about putting a great signal into Pontiac. 89.5 is right there and covering a bunch of the east side and much of Oakland County as well. You might be watching on Civic Center TV, Channel 15 and Channel 19. If you're an AT&T customer, you can tune in today on Channel 99 and just go to the West Bloomfield pages and you will find us. And finally, you can watch us at civiccentertv.com. We hope you check out that website. Lots of useful information, coronavirus information for all of our communities, the county, the Center for Disease Control, the state of Michigan, and a whole lot more. We have a lot of headlines to get to, but patiently waiting through that entire description of what the heck this crazy broadcast is none other than the mayor of Pontiac. We saw her yesterday in the press conference at Oakland County with Dave Coulter, and now she joins us here live on the Megacast as I hit just another button or two. Mayor, you have to forgive me. There you go. We see you now. To keep our social distancing here, I'm the only one in the studio right now, so I'm running a TV and a radio show here at the same time with my fingers and trying to talk to you. So thank you for being understanding. Good morning. Welcome to the Megacast.
Good morning, and it's great to be with you, David, and to talk to my friends and neighbors all across Oakland County. And I understand you're wearing many hats here. I understand that as we're all working remotely, as I am running a city with the same kind of challenges that you have working remotely.
My challenges are absolutely nothing. It is an absolute pleasure to be here every day and do what we can to help out. And but you have your hands full in Pontiac. We, in Oakland County, clearly have a very high number of coronavirus cases. We've had, unfortunately, way too many deaths. And you got your hands full. But today, a bright sign that we're moving in the right direction. We are beginning testing in Oakland County and in Pontiac. Why don't we start off today, Mayor Waterman, by telling us all about that?
That was an announcement that was made yesterday. I was happy to stand there, or virtually stand there, through the broadcast with the Oakland County Executive David Coulter, as he and his executive team announced the partnership with Honor Health to bring in the first testing site in Pontiac. This is one of the drive-through mobile testing sites. This adds to and, of course, augments all the testing that's being done at the local hospitals, and our first responders are doing a magnificent job. They have been working so hard to save lives and to treat people who have been taken down with this serious disease. But this will be the first mobile site, and it is right here in Pontiac. We are the county seat as well, and this is going to be at the Circuit Court Complex at 1200 North Telegraph. We want people to know this is here and available. It's been long awaited, and testing is so important because we're realizing that the one of the guideposts of how we're controlling the spread of the disease and how we can continue to ameliorate this disease in the community is through looking at the data and tracking the records and the demographics of the people who are affected by this or the contagiousness of it.
Well, well said, Mayor, and it is so important. It's so critical, and we have a lot of people focused on the next step right now, and everyone agrees that we cannot get to the next step without testing. Plus we'd also like to know where we're at right now. So it's essential. It's an essential part our going forward plan, and it's a big part of making sure that people we know who's healthy, we know who needs a helping hand right now.
Exactly. And that's what we want to do. We're remembering all those who are suffering with this disease, and nobody in Pontiac doesn't know someone who has either been affected by it or quarantined by it, or there's now 17 deaths of Pontiac residents. So this is a number which is affecting all of us. And the reality of the situation, I think, is there. What we can do as a community is to pull together in spirit and realize if we all cooperate and doing the precautions that have been advised to us by our healthcare professionals and both by the orders from our governor now, who is struggling mightily to control this curve in Pontiac and the neighboring communities. So we're happy for the municipal help that we're getting and that we're all united in this effort
Yeah.
to slow the spread of this disease.
Everyone's doing a really great job, Mayor. First of all, I really appreciate you taking time. I know how busy you are. Thank you for taking time to talk to us. You look great on Zoom. We got all that working. It's amazing, all this technology that we have. So thank you very much for joining us so we can see you and hear you today. She is the mayor of Pontiac, Mayor Deirdre Waterman. And Mayor Waterman, we need to know. We need to know who's sick. We and people need to know that they can go get a test. So up to now, most of us have understood that the only way we can get a test is to call our physician or call the county health department. We need to be sick before they want to test us because we only have limited testing. How's it going to work at 1200 Telegraph at the county courthouse when people want to go get a test? How's that going to work?
Well, this testing is for people who are symptomatic. So you have to have one of the symptoms that has been identified, and people know what those are: fever, non-productive cough, trouble breathing, diarrhea, even. So these are the things that if you have symptomatic and you can't tell, whether it's COVID or not, and you need testing, then you call the number. May I give that number now? It's 1-800-848-5533. That's going to start tomorrow, and it's going to go from 9 a.m. to 5 p.m. So that's available now. We also have a hotline number in the city of Pontiac that's available to Pontiac residents, and that is 248-758-3300. And people can call with all kinds of questions or resources. And that's how we've gotten the information out to our community, as well as through all the PSAs and the website information that we're getting out. Just giving people all the information. I think that's one of the things that's cut down some of the anxiety, is people know that there are resources for food distribution. We're now up to 9,000 some meals to our senior centers to help our seniors and our disabled and homebound who we can deliver them to. So just a lot of people have stepped up to do that, which supports the wraparound, as well as now bringing in the testing is going to be just another step forward in terms of curbing this intrusion of the disease in our community.
So many different aspects of this entire thing: getting people fed, making sure their health is taken care of, just being there for people when they have a question, and so the anxiety level isn't so high. And then our first responders, we've been talking to first responders around Oakland County, curious how things are going in Pontiac. Fire departments and EMS units around the county have been telling us that they're able to make the calls. They're able to keep up with 911 and the hospitals, at least as of right now, and they consistently have said that we've had the beds. Is that the case in Pontiac as well?
Yes, they are stretched. I'm thinking about the hospitals now. We do talk with them, and I've done a couple PSAs with the hospital directors of the outpatient center and the emergency room, and they are not overwhelmed like some communities. They do have capacity, but they are stretching their limits. They're using creative and innovative ways to be able to make sure they can service all the population who needs them right now. But it means a lot of people are putting in a lot of hours, working long shifts, and we wanted to celebrate them. I wanted to reach out and say to them, we thank you so much in this community. And it brings to forth that they're making sure that access to healthcare is not limited as people are losing their jobs, and their healthcare is being challenged right now in terms of how they obtain that. So that's one of the things we're looking to, and making sure that it's accessible to everybody who needs it, because for one person to be treated also protects the rest of us. So we're all bound together in this. It's all tied together in a chain of interrelations. And so that's why it's important for our hospitals and our healthcare agencies to be able not only to give the right advice, but to make sure that they are controlling the symptoms and letting people know how they should behave given the symptoms they may have.
Mayor Deirdre Waterman joining us from Pontiac today via Zoom on the Megacast. How about EMS? How's that going? EMS, fire calls, police calls. You've been able to keep up?
They're doing amazing jobs. They're able to keep up, yes, and we want to help them too because some of our first responders now have begun to test positive. So that has decimated some of the forces a little bit, but the others have just filled in the patches to keep up going, have to keep going, and to service. So they are challenged, but they're able to meet the challenges, and it's just a voice of gratitude from this community for all that they're doing. And one of the ways we're supporting them is we started a program just last week in which we're matching some of the restaurants now who have limited patronage because of the shutdown order and are looking for ways that they can help the situation with our first responder, matching them with donors who are willing to uh, provide meals to our first responders. So I'm just happy for the number of people who've stepped up to be donors for that and support our restaurants or our small businesses in town as they're floundering during the shutdown, as well as pay homage and help our first responders who are working long shifts and late hours. So we've had a number of groups who've stepped up to provide the funding to do that, and I thank them. And I think that's just the way that we're supporting all the work that our first responders are doing to keep us healthy and to help treat those who are the ones who are taken down by
Mayor
this disease.
Waterman, that's one of those win-wins that we're seeing so much of right now. People coming together in our community, supporting the people that are making the greatest effort, the biggest sacrifices. The media reports out today are indicating that the first responders, but more prominently, the nurses are testing positive in bigger numbers than anybody. So we see that, and it's affecting a lot of nurses. And the biggest demographic there is women who are between 25 and 54 years old, and it makes sense. I mean, that is not an exclusive demographic for nurses, but it is a prominent demographic for nurses. And we're seeing media reports today that their percentage of contracting the coronavirus is higher, and it only makes sense. They're right in the front line. These medical workers are literally risking their lives every day
Yeah.
when they go to work.
Yeah. And I don't know if you realize it, but my background before I was the mayor, I practiced as an ophthalmologist. So I still have a lot of colleagues in the medical field, and I talk to them almost daily to find out what their challenges are, to know how much they are at risk, with all the protective gear and everything that they're doing. There's still a paucity of getting that. And so the hospitals are working to get enough supplies to protect our healthcare responders. But even with all that, they are a lot of them have been infected, and so it's really a very, very contagious and mysterious virus that we're dealing with, and they're learning something about it every day in terms of watching the demographics and how it spreads and how it affects people.
Well, and certainly one of the things we have unfortunately learned, and it's been reported in the national media, the local media, we've talked about it a little bit here on our program, is the fact that this nasty, deadly virus is having a greater impact on the African American community than any other community. It's a community that many say is medically already at a higher risk, and this is making things even more difficult. Do you have any thoughts on that, and any mediation or anything that you're hearing that might be able to help that situation, or just your thoughts in general on it?
Yes, and that is the data that has been kind of astounding as we've looked to see how the depth of it and the disproportionate way in which African Americans, particularly, are suffering from complications of the disease uh, is also a reflection of many factors, I think. And as people are assessing that, we're realizing it's not only health, access to health, and the fact that it's a lot of the African Americans who are often in these essential jobs where they're still working, where the rest of us are safer by being working remotely. It's the fact that some of these people are in industries that are affected by the shutdown. and so they've lost their jobs now. We can see by the number of people who file for unemployment because they are laid off due to the coronavirus. So there's a lot of socioeconomic mitigating factors, but we wouldn't have known this had not the data that was collected began to reflect these factors. And that's why it's extremely important. And that's why this testing is even more sequential for the outcomes for communities of color. Pontiac is 51% African American, and so that is extremely more important for us because that affects the outcomes and that affects how this disease affects this community. And as we know, Southeast Michigan is known as one of the hotspots across the country. So the data, and that's one of the things I'm going to be talking to the local health department, Oakland County Health Department later today, is we need to make sure that we're really graphing this and getting that data collection in a way that will be indicative and informative, that will help us not only understand the prevalence of this in certain populations, but also how we're controlling it and how that can affect treatment and how it can affect outcomes because it efficiently save lives.
Well, we are seeing news accounts today. Maybe you could talk to this, and I know we're running out of time, but there are news accounts today here in Metro Detroit that says that folks are calling for adding this data that you refer to, data on race and the impact the coronavirus is having on certain segments of the population, adding that data to the data that we're collecting. Do you think that's a good idea?
Well, yes, it's an extremely good advice. It's important. It's essential to do that. And we've done it for every other disease, every other crisis. Uh, that's a normal part of health information gathering. As a healthcare practitioner, every form we filled out recorded those essential kind of demographics because we know that that can help to guide outcomes and treatment. Uh, the African American Mayors Association, that I'm also a member of, did send a appeal to both the director of the CDC, Dr. Redfield, as well as the Surgeon General of the CDC. We want the CDC to begin to do this tracking and collection of the data and recording it because it's so important, as we've seen. If we had known about this, how this particular demographic was being affected through data analysis some time ago, that might have worked very well demonstrated how healthcare practitioners could affect that kind of treatment with that in mind. So this is life-saving information, and it's done for every other kind of disease collection, and we should do it as well for this.
Do you think, Mayor, that in addition to tracking the information, it might be helpful to test certain communities more aggressively? I know we only have so much testing capacity right now, and all we're doing is testing folks that are symptomatic, but maybe it wouldn't be a bad idea to start doing some more widespread testing in the African American community to try to prevent some of these deaths that have been happening. Your thoughts?
That's what we need to have more capacity to do. And I think this first mobile test site is a good step in that direction, but this is something that we're kind of behind on right now, and we're playing catch up. So everything you said is true, and the more testing we can get, the more we can be in control of our destiny.
All right. Well, the telephone number to call is 8. Let me see if I got these right, and we'll put them on our website. 800-848-5533. 800-848-5533. That's the number you call if you're in Oakland County and you'd like to go to the new testing center. You said it starts tomorrow. Is that correct?
That's correct.
Okay, so you call that number and you'll talk to somebody and they'll get you scheduled. You can't just drive over to the Oakland County campus. You need to call before you go, correct, Mayor?
That's correct. Please by phone.
Okay, so 800-848-5533, the number for the city of Pontiac, the helpline 248-758-3300. Mayor Waterman, thank you so much for being with us today. Very helpful information. Anything you'd like to share with our viewers and listeners before we say so long?
Well, thank you for having me. Thank you for helping to spread this information. I think we control our destiny a little bit, and we help to be of service by giving these resources and that information to the public. I think we all got to get through this together, and let's see the light at the end of the tunnel so we can get back to whatever that near normal is going to be. And I'm just happy to be of service to the community.
Well, thank you, Mayor Waterman. Sounds like you're doing a great job. Thank you for joining us, and we look forward to chatting with you again right here on the Megacast. She is the mayor of Pontiac. Sounds like she is right on top of her game, and we really appreciate her being with us here in the Megacast today. Talk about folks that are helping out. You take a distillery and you turn it into a manufacturing facility that is creating much needed hand sanitizer. That's pretty cool. That's what's going on here all across the state of Michigan, where we have a lot of distilleries now. And we're going to talk to one of those distillers in just a minute from Detroit City Distillery as we continue on the Megacast. I'm Dave Scott. We'll be right back.
Hi, I'm Dr. Jonae Caldoun. We know that COVID-19 is spreading rapidly across Michigan right now. The most important thing people can do to protect themselves is social distancing. That means unless you are a critical infrastructure worker or going out to get food or medicine for your home, you should be staying at home. Stay home, stay safe, save lives.
All right, welcome back to the Megacast here on so many media outlets. I appreciate you tuning in. So if you've never been on the Megacast, or for our next guest, Mike Forsyth, who's sitting here in Zoom waiting for us to get going and looking pretty cool there at the distillery, this is what we are. We are Civic Center TV, Channel 15 in West Bloomfield, Channel 99 AT&T. You can watch it all over Metro Detroit. If you're an AT&T customer, go into Channel 99, navigate your way and find the West Bloomfield TV channels, and you will find us. We are also at civiccentertv.com. We invite you to go to the website, and you can watch the Megacast live in high-definition streaming, and you can see all kinds of other useful information. If you go to the coronavirus link or go to the Megacast link, you'll find a lot of information and helpful links there. We also want to thank our radio stations, 3 radio stations around Oakland County. 89.3 Lakes FM in West Bloomfield, 88.1 WBFH, the Biff in Bloomfield Hills, and WAHS, 89.5 Avondale Community Radio, and Auburn Hills, covering a bunch of Oakland County and Macomb County. So that is a Megacast. Oh, one more. Thank you to the West Bloomfield Police Department. They are our Facebook partner today, and every day we have somebody on Facebook helping us out. So, speaking of helping out, you know what a cool idea. You take a distillery and you start making hand sanitizer. Who would have thought of that? Well, this guy did. Mike Forsyth, the founder of Detroit City Distillery, joins us live in the Megacast via Zoom. Hey, Mike, how you doing?
Good. Thanks for having us.
Well, good to have you. I got you punched up here now. Everybody can see at home. Can you describe what we're seeing there behind you and tell us a little bit about where you're at?
Yeah, so we are at Detroit City Distillery. We're in the whiskey factory. You see a bunch of whiskey rested in some freshly charred white American oak barrels, soon to come to your home bar.
Okay. Well, you must have a lot of willpower to be able to go to work with all that whiskey around all the time.
Yeah, it's helpful this time. So it's been good. Mostly, producing hand sanitizer these days, but still fitting some whiskey production in when we can.
I get it. So talk about that. I mean, and thank you on behalf of all of us in the community. Thank you very much for what you've done, and I know you're not the only one. A lot of other distilleries around the state of Michigan are doing the exact same thing. Tell us about what you're producing and why you got into this.
Sure. So we've been producing about 3 weeks now. It was kind of instigated. The Detroit Police Department reached out to ask if we could help, and we were thinking about it. And so, we just jumped into action. It's kind of the Detroit way. When you're called to step up, you do so to help your fellow Metro Detroiters. And so we produced about 8,000 gallons to date that we've been distributing to hospitals, healthcare institutions, the state emergency office, state police, local police, postal workers. So it's been good to help out on the front lines, and it's been an honor to serve.
So tell us a little bit. I mean, I don't really understand the distilling process much. I'm a little bit more knowledgeable in the consumption side rather than the production side.
Sure.
But tell us, how does it all work? And talk about transitioning your operation into a hand sanitizing manufacturing facility.
Sure. So, as a distillery, we're obviously dealing with large quantities of alcohol every day. We make it from scratch. It starts with grain, you cook it, you then ferment it, you add yeast that creates alcohol, and then you distill, larger quantities of what is essentially beer down into whiskey. And then it goes and sits in these barrels behind me for about 2 years. And then it gets bottled and goes to you. In terms of hand sanitizer, though, the process is actually relatively simple. We're developing it per World Health Organization recipe, and that is something that the federal government allowed us to do about 3 weeks ago. So it's just alcohol, glycerin, and hydrogen peroxide. Luckily, our master distiller, JP, has a PhD in microbiology. He used to work in biogenetics labs. So he's been mixing up the batches, and the guys have been bottling. And yeah, we've just been trying to get the word out and get it to as many people as we can to help, address the crisis.
Mike, I'm just cracking up here. Forgive me. I mean, the whole thing is just, I think you can understand whiskey's kind of a fun product, and then now you guys are saving lives, and your master brewer, distiller there has got his PhD or whatever you just said. I mean, I'm just sitting here listening to your whole story. I'm smiling and cracking up, and I'm not the only one, I'm sure, but it's a really cool story. And talk about the community coming together. Absolutely incredible what you're doing. From a business standpoint, is it helping keeping you alive? Are you donating these products? Are you able to bill for some of these products? If you don't mind me asking, how's that working? Because we're concerned about every business.
Yeah, no, it's a good question. So obviously, this has had a tremendous impact on our business. Our tasting room is closed. We have an event space here at the Whiskey Factory. Obviously, that's been closed. We've had to reschedule or refund a number of events. We've lost half of our customer base in distribution, who are also, running bars and restaurants and hotels in the industry. So the pivot to making hand sanitizer has really helped us keep afloat. We still, have been able to keep half our staff employed, which is kind of priority number one. And we're, it's difficult because you want to donate it, but how do you justify donating something when you're losing tens of thousands of dollars every week? You're thousands of dollars on hand sanitizer. But I feel really good about it because I think we are being really fair. I mean, we researched prices before the crisis, and we're actually, pricing it at below market rates before the crisis hit for those, who are working on the front line. So, we're getting a lot of hand sanitizer for folks that need it. And we're trying to be really fair about it. Well, trying to survive this crisis as a small business. So,
no, listen, Mike, don't get me wrong. I think what you're doing is heroic. It's beautiful. You should be charging for it. I think you set an example, as all these businesses are, that have decided how to pivot. I'm not accusing any business of shutting down and laying off all their employees of taking the easy way out, because everybody can't pivot. But for those that can, for those that have the capability, change is hard. I mean, come on, change is really hard. And I'm sure it's been hard for your employees to pivot too. But if you can pivot and you can help out, it's an amazing thing. And that's why I wanted to hear your story, because, you're making hand sanitizer, but you are also a business that had to pivot. And you've been able to pull that off. How's that going with you and your employees?
Good. I mean, we're in Detroit. They call it the arsenal of democracy for a reason, right? So, it feels good to be a part of the community and be on the front lines. I think that's what's keeping the guys going. It's nonstop, basically, all day, every day. So, I think the greater mission and the ability to help people is really kind of what's keeping us going. We're bottling a little bit more bourbon right now. Feels good. We're waiting for more supplies to come in for hand sanitizer, but just to be able to address it at a meaningful scale has really, felt good, despite everything to the contrary. So, it feels good to be on the front lines. It's been an interesting look into the need and, some of the challenges folks are facing with the supply chain right now is absolutely wild. So being able to figure that out and be entrepreneurial and pivot quickly has been, a great experience despite a very trying time. So feels good.
Mike, good job. Great job. And, I want to come meet you. It's unfortunate we've not had a chance to meet. As soon as this is over and we get back to normal, I'm gonna get on my motorcycle. I think that's a perfect way to come visit you. And jump on down on the bike and then come on down and see you. And maybe we can, I'll be riding the bike, so I can't do a shot of your product. But we let's meet. I want to hear your story. It's so fantastic what you're doing. Thank you very, very much for joining us today. One final question. A lot of our audience is in Oakland County. How things going in the city of Detroit?
It's tough. I'm not going to sugarcoat it. I mean, we've supplied around 500 gallons to the city of Detroit, mostly going to the police department, fire department, which has really been hit hard by this. We just sent 70 gallons out the door. That's going to go to every independent grocer in the city, thanks to Eastern Market. So it's hard. I think people are really taking it seriously in the city, but it's hard. We've lost friends and colleagues to this, and the silver lining is being able to do this to serve the greater good. Is the only kind of thing keeping us going through this. So it's hard seeing your hometown affected at a greater degree than most other places. And, we know a lot of folks here struggle with access to information, paying water bills and utility bills and all that. And so, the little bit we can do to help feels good. And, that's what Detroiters do. They take care of each other.
Mike Forsyth, keep a smile on your face. You're saving the world one hand sanitizer at a time. Beautiful job.
Thanks.
Thank you very much. Look forward to meeting you, and thank you for joining us on the Megacast today.
All right,
it's been
take
great
care.
to get
Looking
to know you
forward to
virtually. Look forward to meeting you in person, my friends. That's what this is all about. I couldn't feel better after that. Hey, we're going to take a break. We'll be back in a couple of minutes with more on the Megacast. I believe we're going to check in with Oakland County Commissioner from the 13th District, Marcia Gershenson, checks in a couple of moments. We've got that, and we'll check all the coronavirus news headlines and much more coming up. My name is Dave Scott. This is Civic Center TV and the Megacast, along with 89.3 Lakes FM, 88.1 WBFH, WAHS, 89.5 Avondale, and our Facebook partners today are the West Bloomfield Police Department. We will be back in a moment.
Hi, I'm Dr. Jonah.
Hi, I'm Dr. Faust. Hi, I'm Dr. Faust, the Medical Director for the Oakland County Health Division. The most important thing you can do to prevent the spread of illness is to wash your hands thoroughly and often. Follow these 6 easy steps every time you wash your hands. Step 1, turn on the sink and wet your hands with warm water. Step 2, apply soap to your hands and lather between your fingers, under your nails, and the front and back of your hands and wrists. Step 3, wash your hands by scrubbing them together for at least 20 seconds. Step 4, rinse your hands with warm, clean water. And step 5, dry your hands with a clean cloth towel, a paper towel, or hot air blow dryer. If you're using a cloth towel, make sure to change it often. For handheld faucets, turn off the water using a paper towel instead of your bare hand. Step 6, if you're using a paper towel, throw it away. Practice healthy habits like washing your hands after coughing or sneezing into them to keep you and others healthy. Go to oakgov.com/health or call Nurse on Call at 848-5533 to learn more.
All right, thank you very much, and welcome back to the Megacast. Dave Scott here. If you're watching one of our video outlets, you can see I'm sitting in the Lakes FM studios in Walnut Lake Road in West Bloomfield, and this is our radio studio here. I got all these buttons around me, though, because we want to keep our social distancing. There's no one else in here with me. The rest of the team is scattered throughout the building and at their homes making this show work. And let me tell you, there are a lot of folks that make all this happen. We got our Zoom producer, our show producer, our technical producer, and a handful of other people, the folks that are making social media happen. So we're all scattered around like we should be right now. I got to tell you, that was a great story, hearing from Mike Forsyth from the Detroit City Distillery and what they're doing there. Also good to hear from Mayor Waterman in Pontiac. We are going to check in later on the show with Brenda Lawrence, our U.S. Congressperson from the 14th District. And let's see, we got a mayor, we got our congressperson. Let's get one of our county commissioners on the line. Joining us is Marcia Gershenson, Oakland County Commissioner of the 13th District. Let me hit a button here. And Commissioner, thank you very much for joining us on the Megacast today.
Well, thank you for having me. I have to say, before we get started, why don't we meet for a drink at the Detroit City Distillery when this is all over and celebrate a little bit.
You know, I like that idea. But here's the deal, Marcia. You're driving, okay? That way you can be our DD.
Yeah. No, I heard that. We'll have a designated driver for sure.
All right. Sounds like a great plan. You know, listen, I'm glad you said that, because I do see the end of this. You know, I really do. And I know it's going to be very complicated to get there. You know, we could talk about that if you want today. And figuring out what the governor has had to do, what the federal government has had to do, what you guys have done here in Oakland County. Very complicated to date, but I think maybe even more complicated figuring out how do we get to this new normal. What do you think about that?
Well, before we get to that, I think one of the things I've really been struck by listening to your show, which has just been great, and I actually have telecast from your studio before. You've got a great facility there, and I do appreciate everything you're doing for the community as well. But our new county exec, David Coulter, is totally fixated on regional cooperation. And that's something I'm totally committed to too. I have a real kinship with the city of Detroit. I grew up, I was born and raised in Detroit and did my public school in Detroit. So I have a real affinity for Detroit, and our David Coulter has really stressed this regional cooperation. Another area we're really focused on is Pontiac. So on this show, I've been lucky to be connected to a lot of people that I really admire from both of those communities. And we're doing a lot with the city of Pontiac. It's a priority for the commissioners, and it's a priority for our county executive, Dave Coulter, our administration. So I am an optimistic person by nature. So we are beginning to plan for what things will look like once the order subsides. Of course, if it's over on May 1, if things start to ease up by May 1, we're working now to see what would that gradual reopening look like. We're connecting with business leaders, and our administration is really working on just starting to get ready to see what things would look like once we reopen. It'll be slow for sure, but hopefully it'll be well thought out, and we'll have this testing under control. That's the testing that Mayor Waterman talked about that's beginning tomorrow in Oakland County, which we're very excited about.
Well, I was delighted to watch a press conference yesterday and hear from Executive Coulter on the plans, the updates, and then this testing opportunity that's going to be happening starting tomorrow at the county courthouse, the county complex on Telegraph in Pontiac, and that's a great addition. It's a great addition. We need that testing, and it's a great addition that testing is in close proximity to the city of Pontiac, Commissioner Gershenson.
And one thing I've talked about with our administration is that we're known as a very well-run county. We have a AAA bond rating, and we're very fiscally sound, and we are handling this pandemic pretty well economically from a county level. So one of the things that I wanted to mention is how people step up. Our health department, which has always been exemplary, has won awards. I guess it's easy for people to excel when things are good, but when things get tough, some people really step up. And our health department, under the leadership of Kathy Forsley and her chief, Leanne Stafford, have just been remarkable in their response. And our whole health department team, those folks that are coming in during this pandemic to work our nurse on call line, which is available for folks to talk about anything they're concerned about. Those people are staffing those phones. And of course, that's the key to getting tested, is that you need to call our nurse on call, which I know Mayor Waterman gave you the phone number, but I think I'm happy to repeat
Yeah,
that.
I've got it right here, 800-848-5533, 800-848-5533. And you said it well, you know, the Dr. Fauci and the national folks, our state folks getting a lot of attention on the health side. But really, when you think about it, it is the county and the county health department that is on the front line of deploying health care to people that don't have a physician, the people that need help. And from what I understand, Marcia, it's also the county that is really right in the middle of the pipeline for supplies. A lot of these supplies that might come in from the federal government and other organizations are coming through the county. You guys are right. I don't know if people realize it, but it's your infrastructure that's keeping all this moving. Did I get that right?
Absolutely. You know, when I campaign, I can't tell you how few people know what county commissioners do, but we really do work on issues that affect people directly. Not only do we work on the budget issues, but our health department and our sheriff's department, which is really stepping up, as is your West Bloomfield Sheriff's Department. The local police and fire chiefs are really right there for us. But we are receiving donations at our old farmers market, our Oakland County farmers market on Pontiac Lake Road, and the outpouring from local businesses has been fabulous. We still need more. We're really short on gowns. We're getting a fair amount of gloves and masks, although don't misunderstand me, we could use more, because with the new order that is coming out on Monday, which is going to stress that everyone that cannot socially distance and that is interfacing with the public needs to have a mask on. So it doesn't have to be an N95 mask. It can be a homemade mask. And that's another thing that's really been remarkable, is how many stay-at-home folks are making masks and posting them on websites such as Nextdoor, or however neighbors are communicating with each other. This has been such a wonderful example of cooperation. It's neighbors trying to help neighbors. We have folks on my street that are offering to go shopping for other people. Of course, we really appreciate the restaurants that are offering home delivery. But definitely, we feel that we are on the front lines. And one of the sad things is that some of the equipment we're getting from the federal government, we just got two highly sought after testing machines from Abbott Labs, and they were missing a part.
Oh, no.
So there's been some frustrations. Those are the quick acting tests. Although I will say, Oakland County, when we start our testing, we're going to be getting the results pretty quickly, because we're going to be using our own labs. And so it won't be that torturous 2-week wait when people really can decline from from the diagnosis.
Oakland County Commissioner Marcia Gershenson joining us here on the Megacast via Zoom. We thank her very much. You can't see me, Marcia, but for the folks that can see at home, I have, here is my mask. It's just, listen, I grew up in the 60s and 70s, so I just went with classic. There it is, classic bandana. I kind of look like a gangster when I go into the stores, but that works pretty good. I just take that, tie it down, and it gives us the kind of protection that we want. In Oakland County, we only got a couple of minutes, so I'm going to kind of do rapid fire with you, if that's okay. In Oakland County, you do have this new order that's coming out that is on top of the state's order. So it's something you've done in addition to Oakland County. Executive Coulter announced it in the press conference yesterday, and it's requiring everybody to wear masks. As you stated, if they are an essential worker and they're going to work and they can't keep the social distancing, or if they're in a store, a grocery, a restaurant, somewhere where people are coming in, you're required to wear the mask. That is on top of all the state's requirements. Are you with the county executive on that?
Absolutely. We were really ahead of the curve. If you listen, one of the things I have to say about our county exec, Dave Coulter, he's doing daily updates at 1:30 on our live stream on the Oakland County County Executive Facebook page. And to me, that's what leadership looks like. We are trying to communicate what's happening because information is changing daily. The one thing I want to be sure and get out to the residents is that we have provided grants and loans to small businesses. We're now just picking through the applications for grants, and next week we're going to be sorting through the applications for loans. This is not the deadline to apply has passed, but there will be more programs coming. We are committed to use our resources to help our businesses, help save lives. And I guess if I had one other thing, Dave, to close with, it would be to encourage people to wash their hands constantly. They're saying that that's one of the greatest defenses against, along with the mask, the washing of the hands is just so important. So,
Marcia, I want to take all of the political stuff, and we're just going to set it aside. And you have never been a highly political person. I congratulate you for that at the outset. But let's set all that aside for a minute. And let me say, as I go into this, that the governor's job is impossible. I mean, it is impossible to document what she has had to document. And because of that, it isn't going to be perfect. And there's a lot of people that don't like what she's doing. Let's be honest. There's about 5,000 cars running through Lansing in the next hour of people that are not happy. We all know it, so I can't hide from that. But, you got to give her the benefit of the doubt. It isn't easy. I sat down, I was playing around trying to write a set of my own rules. You can't come up with it. You set one rule and you get rid of something that you need, and then you end up with getting rid of something you don't want to get rid of. So and we could debate if what she's done, whether it's right or not. But can I get your thoughts on what we need to do to come out of this? The county, Oakland County in particular, has always been a very business-friendly county. If there's a county in the state of Michigan that needs to come out of this and business needs to thrive, it's Oakland County. We represent so much of the economy in the state of Michigan. Can you let our listeners know, are you guys working in a nonpartisan way to figure out a way to come out of this thing in a way that's going to keep us healthy, but is going to help our businesses get back to work?
Absolutely. We just are working on a resolution which is going to come into the to a committee that we have formed to look at how we can reopen and help our businesses reestablish. That is not a partisan effort. And I have to give kudos to Governor Whitmer because she's assembled a team of very high profile business people to develop a thoughtful re-entry program. And we are going to be doing the same in Oakland County. That's one of the resolutions that we're going to be working on is how do we reopen? How do we support everyone that has suffered? It's a priority for us. We have the resources to help, and we intend to use them.
Do you think that we've learned some things over the past several weeks? You talk about washing hands, wearing face masks. Do you think we can deploy some of these things, Congressman? I just gave you a big promotion. Commissioner Gershenson, do you think we can deploy some of these strategies and get back to work?
I definitely think so. I know I personally have learned so much. It's an honor to be in the position I'm in where we can really try to make a difference to help people. We're almost every elected official, pretty much every elected official, their numbers are public. They're encouraging people to reach out. We have tremendous resources with United Way and their 211 resource number, which I would encourage anyone that's having mental health issues or financial issues. This is stress, and there's no getting around it. It's okay to be freaked out, because we all are to some extent. But those of us that are on the front lines in terms of trying to work through this, have confidence in your electeds. We are doing everything we can to reopen our businesses and to support those that have had to slow down.
All right. Well, I could just say on behalf of one business person in the county, because in addition to doing this, I run a business with 20 employees. I can tell you that in addition to what you just said, that I've worked with the Oakland County Business Development Unit, and when all of this came up, they called me. They called me, Dave, how's it going? Everything okay? Anything we can help you with? Do you know about this and that and the other thing? And it's not just because I'm in the media. They don't even know that I do this silly little show. I've worked with them. There's some really good people in the county. It is you do have a really great organization, and I thank you for coming on the show today, and we wish everybody the very best, and we're just hoping and praying that we're going to come out of this and everything's going to work out great. I think it's going to be a fantastic summer, and I look forward to taking you up on your invitation to head down to the Detroit City Distillery before too long. Marcia, thank you for joining us on the show.
Look forward to it, too. Thank you so much.
She is Marcia Gershenson. She is the Oakland County Commissioner of the 13th District. Coming up in a couple of minutes, we're going to talk to, if we get everything worked out, U.S. Representative Brenda Lawrence from the 14th District. She is representing most of you that are listening right now in Congress, and we are delighted to have her. So we get our Congress member, we have our mayors, we have our county commissioners, all these electeds working together. We're really glad to have them on the show today. We're going to take a break. I will be right back, and we're going to share some of the news headlines that are going on the coronavirus front and get you up to date on that. Tell you a little bit about our carryout club, and then go to our website and listen to what some of the big newsmakers have had to say over the last couple of days here in the Megacast. Dave Scott will be right back.
Hi, I'm Dr. Jonay Caldoun. I'm the Chief Medical Executive for the Michigan Department of Health and Human Services. The people who are at highest risk of getting severely ill from COVID-19 are the elderly and those with chronic medical conditions. That includes people with heart disease, diabetes, COPD, or those who have compromised immune systems. People who are in those categories should right now be staying at home as much as possible and not going out if it is not essential. If you fit into one of those categories, those are the things you should do. And if you have a family member who fits into one of those categories, you should be checking in on them and making sure they are following those guidelines. There's something everyone can do to protect the community from COVID-19.
I know you're concerned about the coronavirus, and we're working hard to combat its spread and keep your family safe. But we need your help too. Wash your hands often with soap for at least 20 seconds. Avoid touching your face and cough into your sleeve. Replace handshakes with an elbow bump. Avoid large crowds or events, and if you're sick, stay home and call your health provider. Every one of us can make a difference limiting the virus's spread and keeping Michigan healthy.
Thank you, Governor Whitmer. I appreciate you doing that. Right when she said, "Don't touch your face," I touched my face. It's hard. I think that of all the instructions I think that's the hardest instruction to follow. Thank you for joining us on the Megacast. My name is Dave Scott. I'm sitting here in the Lakes FM studios on Walnut Lake Road in West Bloomfield. And this is the Megacast. If you're not tuned in, we thank you very much for doing so today. The Megacast is on a zillion different media outlets, so we can reach you wherever you are. I want to thank the West Bloomfield Police Department for putting us on their Facebook page today. That is greatly appreciated. I want to thank our radio stations, 89.3 WBLD Orchard Lake, 88.1 WBFH Bloomfield Hills, and WAHS Auburn Hills radio stations. I know I did that a little early, but there you go. There's your legal IDs. 3 great radio stations spreading the signal all around Oakland County. Thank you for watching on Civic Center TV, Channel 15 in West Bloomfield. And actually, the better place to watch it, nothing wrong with watching it on cable, but you'll get it in full high definition if you go to our website, civiccentertv.com. Go there, and you'll be able to see the entire Megacast on TV. If you go to our website, you're going to find a lot of additional very useful information. There is a coronavirus link on our website, I should back up and say, is civiccentertv.com, civiccentertv.com. You can go to the coronavirus page and you'll see the headlines of the day, and we're going to zip through these really quickly right now and find out what people are talking about around our region. These are not the big national stories. This is what's happening right here in our area. Oakland County to begin drive-through testing tomorrow. You heard from the mayor moments ago, and you also heard from our Oakland County Commissioner, one of our Oakland County Commissioners, reminding you that tomorrow testing begins in Oakland County. The telephone number, if you want to get tested, 800-848-5533, 800-848-5533. The testing will be going on up at the courthouse on Telegraph, just in the Pontiac area. Easy for everybody. 250 tests per day by next week. And as you heard Marcia Gershenson say a couple of minutes ago, those tests are done locally. They're going to get turned around quicker, and hopefully they have a couple of the Abbott Labs machines. Are not working yet, but when they get all the parts, maybe they can start using those. Those give you instant results in like 15 minutes. Henry Ford Hospital of West Bloomfield circulates a YouTube video celebrating frontline workers. We see a story today in a number of the media outlets that say the nurses are getting the coronavirus at a higher percentage than virtually anybody else. So these people on the front line, absolutely amazing. Here is a really helpful link on our webpage today from the University of Michigan. Go to civiccentertv.com, coronavirus. New website helps answer questions about federal stimulus checks. University of Michigan has posted a new website to help answer questions about those stimulus checks. They should be starting to show up in many of your checking accounts. If you've not seen it yet, you want to know more, here's a link. It's right here on the page. Too long of a link, I think. Let's click on that and see if it's, it's not that bad. poverty.umich.edu/stimulus checks. poverty.umich.edu/stimulus-checks. Much easier just to go to Civic Center TV. Find the story. There's a link right there, and you can click on there. How about this story from the Troy Police Department? The Troy Police Department responds to calls about stay-at-home violations. So it's not going perfect everywhere. Troy Police Department said they've had a few calls. They've responded from teens dancing in the rain at their high school parking lot to a man driving around the neighborhood screaming out his window that he had COVID-19. I'm sure there are people in the community that need help. By and large, members of law enforcement are saying, you know what we're going to do? We're going to try to give people help rather than write them tickets. But you go too far, you're going to get a ticket. Oakland County requiring essential workers to wear face masks. New rule in Oakland County, and we're not seeing that anywhere else around the state of Michigan. This is another rule, a local rule. We're seeing most of the grocery stores and restaurants and places you're going into doing that anyway, right? But the story says over 22,000 Michigan citizens have been infected by the coronavirus, and over 1,600 people have died in Oakland County alone. There's been over 5,000 reported cases and 350 deaths. That's why Oakland County officials have issued a new health order going into effect in a couple of days that says you have to wear a face mask. You have to wear a face mask. So that's for essential workers and those workers that are working in public. And if you're an essential worker and you're working in an office and you're not in public, still need to wear the face mask if you're not able to keep social distancing. Governor Whitmer has extended the expiration of driver's licenses and state ID cards. There is a story about that on our website, and that affected me. My driver's license expired in March, and I was unable to renew the driver's license. So we will have some time. So if you are having a driver's license issue, you need to get your driver's license up to date, or your plates have expired. Don't worry about it. You're not going to get in trouble. You'll be just fine. A couple of other stories. Michigan buying back liquor from bars and restaurants. Senators are going to be holding a town hall meeting. Our state senators. Let me click over here so you can see that. Senators are going to be holding a town hall meeting on COVID-19, and there's a link there on our website. That's going to be happening with all of our TV stations, just like they did with the governor a week or so ago. Really nice to see all of the Detroit television stations all coming together. It'll be on all the channels. You'll have all the different anchors asking the questions. So that is really, really fantastic. And then if we keep scrolling down the page, you're going to see a number of stories here about people in our communities around southeastern Michigan that have done an amazing job helping people out when they need to and making sure that anything that they can do, whether it is a distillery no longer making whiskey and they're making hand sanitizer, or it's a couple of kids that are students in our area schools that are putting up a website called Quarantine, or it's a community organization putting face masks together. So many unbelievable great stories happening in our community, and we salute our healthcare workers, our first responders, and those of you that are making a difference. All right, it looks like she's got everything set up now, so we are going to check in via Zoom in just a minute with our member of the U.S. Congress here in southeastern Michigan, Barbara Lawrence, and she is just hitting. I hit a button here too, and I hit a button there. And Congresswoman Lawrence, thank you very much for joining us here on the Megacast.
Oh, thank you so much for having me on, and I just want to say before we start talking, for everyone, please be safe. We are going toward the middle of this epidemic and hopefully start seeing the downside of this. We have been struggling with this going uphill, and I think the better days are ahead.
Well, I appreciate that message of optimism. I agree. I agree. And, let's add one other little optimistic message here as we get going today. How about the heroic work of just everybody? Almost everyone seems to be complying with these tough orders that we all know that we have to deal with. Our first responders, amazing. Our medical workers, amazing. And we could take the whole show just listing off all the people that have come through. Doesn't that make you feel good about America?
It's through all of this heartbreaking experience, it has been so refortifying me as a citizen of this great country. There people who we normally just kind of walk past, we now see them as heroes, like the cashier at the grocery store, the postal worker, the custodian. We are now looking at them as our heroes, because things that unfortunately society have said, oh yeah, they do that because they can't do anything else and you don't see the value in them. We now see our nurses, you can't say enough, and home care providers, those who are working in nursing homes and going every day into homes of those who cannot take care of themselves to take care of them. And how about the food delivery drivers? Whoever thought we would look at them as a hero because they're bringing food to our homes. So this has been, to me, a moment for America to stop and just reevaluate what's important to us. And I hope this continues.
Congresswoman, are we getting what we need here in Michigan to get through this from the federal government?
It has been a struggle. I will not deny that. It has been a struggle. But what Michigan has done, like so many other states, we have learned how to find the resources and make it happen, and not point fingers, but say, okay, if we can't get it from the federal government, we'll, through the compassion of so many wealthy businesses who gave their private jet and flew to China, who flew to Italy to pick up medical supplies, and the nurses who, we have students who hadn't completed their medical training who are stepping up in that official capacity. We've had retirees come back to work. And so we have seen the Hyundai who contacted me and said, we want to help, and donating $100,000 and gave us 10,000 rapid response test kits. It has been just unbelievable, the pouring out of compassion and the ability for us to just lock arms and say, everyone has a piece of this. The TCF, the Suburban Center, those are not, Suburban Center is not a government building. And a private owner said, we're going to open this up for us to expand beds and take care of people. So we learned a lot through this. And one thing I want the public to know that has been extremely troubling for me is our lack of ability in the United States to supply our own medical needs. Almost all of our PPEs are manufactured and shipped to the United States. There should be a number, and we are pushing for this, manufacturing opportunities for entrepreneurs to come in to make surgical gowns, to make face masks, to make gloves, the cotton swabs. We didn't make any of that here in the United States, so we were held hostage. We learned a lot through this, but I'm just so impressed with the generosity, the compassion, and it's like one no doesn't stop the show. You just that's a no, so let's find the yes. And I've seen a lot of that with our governor, with our mayors, with our first responders to, figure it out. Who thought you could wash a face mask and sanitize it and reuse it? And who thought so many people would bring out their sewing machine and start making masks? So we learned a lot through this.
Well, we have, Congresswoman. And, I just want to go back to your comment. Matters of international trade are complex in our country. They are complex. They get partisan. It's difficult to find consensus. And you work in a body that I'm not so sure is designed to easily get to consensus, just in its structure. But that said, maybe a good starting point, I really like what you said, maybe a good starting point is to say, medical supplies that are critical to sustaining life in the United States should be manufactured in the United States. Is that something we might see out of Washington?
Absolutely. Absolutely. We went through, and some of us are old enough to remember when we went through the whole oil situation, and we were so dependent on oil that was imported into our country. And now we're saying we can supply the oil to ourselves. We changed our philosophy and said, what do we have here at home? We cannot and should not ever be in this situation again where we are dependent on other countries. And because this was a pandemic, so many other countries were going through the same thing. And so you had stock materials for PPEs, which was our biggest crisis, ventilators and PPEs, personal protective equipment. And a lot of people, a lot of companies rolled up their sleeve, thank God, and just started, how do we manufacture this? What materials do we need? How do we make it? And, something that was really interesting to me were cotton swabs. I mean, really? We grow cotton in this country. We know how to manufacture anything, and we didn't have that. So things will change. I agree, because I'm pushing for it.
Well, it's really good to hear because, that seems like an issue that Democrats and Republicans and the president could certainly all agree on, don't you think?
I've said that before. I hope so.
Okay, well, I appreciate it. I hope you take some leadership on that. How is the issues that we're facing here in Michigan, the big numbers that we're facing, is that being recognized in Washington? And do they know how much trouble that we have gone through here? I know we're coming out, but do they understand the severity of what's going on? Have you been able to communicate that to folks in Washington and get us what you think we need?
The good thing about this are the numbers and the facts. So when you start, as you know, every day they show the number of deaths, the number of contamination, infections. And we have, for the last month and a half, been the third highest in the country, which they use the term a hot spot. So we've had, unfortunately, the title of a hotspot, and the numbers are real. And the deaths have just been overwhelming. And the other thing that came out of this was how this virus was impacting the African American community. And I want to talk a little bit about that, because when we went to the medical community, everyone gave a reason. So we are African Americans, we're infected more than others because of underlying conditions, blood pressure, diabetes, heart disease. And there was, then it was kind of like, yeah, that's why they're dying, because they have all these issues. We must take from this, every tragedy gives you an opportunity. We must take this as an opportunity. Why does the African American community, Hispanic community, Native American community in this country have so many underlying conditions? And a lot of people talk about it's a result of poverty. It's a result of food deserts. It's a result of lack of medical care. But whatever it is, in these United States of America, it shouldn't just be that's why they're dying. It shouldn't be. It was our slap in the face that we have some issues in our community that we need to address, because it's not acceptable to have disparities in our health care. And so that's the governor stepped up, and she said, in Michigan, we're going to start a task force and study this, because it's not acceptable for 14% of our population to be infected at 38%, and for the people who die from this disease, 40% African American. And then next was Hispanic. And so we have some work to do. And it's just not acceptable to say that's our norm in America.
U.S. Representative Brenda Lawrence joining us on the Megacast. She is on Zoom. If you're watching us, if you're listening on the radio, it's great to hear your comments, Representative. Earlier in the show today, we talked to Mayor Waterman from Pontiac, and she said, and others have said, that it would be a really good idea to start tracking the metrics on African Americans so we can see the numbers. We see the deaths. Now we're starting to see the successes, people getting out of the hospital. I think that's good.
Yes, thank goodness.
Really nice to see that. But she said, and others are saying, and I'd like your opinion, maybe we should track minority communities so we see the metrics, so we have the numbers, so we can react. Your thoughts?
So you can't fix anything unless you can define the problem. And that's the challenge we have. We know the results, but we have not defined why are we here? What is this about? And one of the other glaring issues that came up, there were some medical facilities, some health organizations that are not tracking the deaths and the infections by race. And so you saw the ones who did, and it was so disproportionate. Then you got this unknown group. So who are the unknowns? And a significant number in the hundreds. So we are, one of the things we're doing on a congressional level, as I'm a member of the Congressional Black Caucus, is to demand the CDC and the Center for Disease Control and the Health Department, HHS, to track all of any epidemic, pandemic by race. And that's when you can have the numbers. So 3 things we've asked for is that every medical facility, when they're filling out the paperwork, that they have a race box. So then we can actually see the real numbers. And then secondly, is that there is a report made to the public so that we know what those numbers are. It shouldn't be a secret. And then third, and this is for me is so important, what's our plan of action? How are we going to address that? You know, I will give you an example. Deaths by automobile crash. How do you think we came up with seatbelts? How do you think we came up with airbags, car seats for our babies? It's because there was medical information that said when a child sits in a seat and it is propelled, when a seatbelt doesn't fit a baby, you have to get the data so that we can begin the healing process and reducing this disparity in our country.
Our representative in Congress, U.S. Representative Brenda Lawrence, joining us. I hope you're doing okay on time. I appreciate all the time you're taking for us and with me and in particular our audience. Good to have you with us. So you say that's really interesting what you just said about seatbelts. I think it's a wonderful analogy. So the current equivalent to that in this environment is washing our hands, putting the masks on, all these things. Are we going to be able to take this toolkit and apply it to get back to whatever the new normal is? Do you see that? And do you have any thoughts about what the next steps are going to look like?
So I'm really encouraged by the number of people who have gone home and stayed home. And I know people are getting stir crazy and they're kind of getting cabin fever. I'm sitting in my home. I've been sitting in my home for over 3 weeks now. I had to fly to DC to vote. It was extremely stressful. But when I got on the plane, it was only 6 people on the entire plane. So social distancing was not an issue and there was no one in the airports. However, I don't see a time in the immediate future where we go back to hugging and shaking hands and having that just social contact that we normally do. But washing your hands, sheltering in place, social distancing, the mask, the gloves, because we don't know how it's transmitted. And a lot of people who are saying, you know, this is ridiculous, it's too much. It's too much because we can't tell you that if we stay 6 feet apart, we will never have to worry about getting the disease. We don't know how long it lives on a surface. We don't know if we touch a shopping cart, if the virus is still alive. We don't know if you hand me a plastic bag and you don't have on gloves, is the virus on that bag? So until we can get there, because right now we're trying to keep people alive. The research is happening, but we don't have those answers. So if you feel this is too much, thank God it is, because it is working, because we're starting to see a stabilization. And I know some people say the governor is just overdoing it. She's just doing too much. I thank God she is, because to me, that's a sign of the government having the compassion to say, we will do anything possible to keep people alive. And I ask people to please just have some patience. My husband and I were talking about this with my granddaughter. Think of the reality that we have a home that we can shelter in. There's homeless people. There are people who have all kinds of issues with housing. One of the things that I want people to know, my priorities was a water shutoff and utility shutoff moratorium. So if you're telling people to wash their hands and to be able to shelter in place and there's no water in the house, we need to put a moratorium on this until this pandemic is over. Secondly, also fighting to make sure that our municipalities are funded, that they're getting the money, because you just heard the mayor of Detroit, which I represent Detroit as well. And he's saying that, they're losing revenue. The casinos was a major contributor to their tax base. And then companies that everyone's laid off. So taxes that you normally pay on food and products have been reduced tremendously. So we are looking at, and then the postal workers. So many people take that for granted. I was a postal worker, and they come to your house every day, and they're losing money because people are not, the businesses aren't working, so they're not sending mail out. And so they're reducing their revenue. And so we have to keep the postal service afloat. In addition to that, we're talking about voting by mail. If you have no postal service, how are we going to protect our democracy?
Do you see, Congresswoman, do you see, sorry to interrupt, but do you see a situation where we are going to be able to help out, the federal government will help out Michigan, will help out Detroit, will help out the postal service? I agree with you. I think you're right on target. But I don't think people realize how difficult this budget is going to be to work out in these municipalities, right down to our local municipalities. And unlike the federal government, they cannot operate at a deficit. You want to talk about that?
So the other group, before I answer your question, are the hospitals. The hospitals are just being overwhelmed. All the tax dollars goes through my committee, and we have to allocate it. We have to take the budget and allocate the funds. As you know, you can't print money, and we are properly, and thank God we are able to do it, to provide stimulus checks, to give loans to small businesses who need it. In addition to that, we did give a small amount of money to the Postal Service. They're going to need more. We did the CARES Act, where there's stimulus dollars being given to all working employees. Unemployment has been enhanced. And we're trying to create this financial bridge for America so that they can stay afloat until things go back and, we can go back to work. With that being said, we still have all of our bills, all of our plans to what makes America, the programming that we fund. In addition to that, something that a lot of people don't realize, SNAP, which is a food service, for the poor, has been enhanced. The food lines are just really breaking my heart around the country. People are without food. But with that being said, we're going to do a CARES Act 2, and we're scheduled to go back to DC the first week in May unless things change. It's a plan. So we haven't been confirmed, but we're looking at May 5th to go back to Congress to vote on the CARES Act 2, which we know that one-time payment may not be enough. The checks are just starting to come out this week, and we know that there will be no employment or no work until we're going to look at it again the first week in May. And so there may be a need for another series of checks to be mailed out to the communities, and some more grants or loans to the small businesses. Because, if you were an ice cream store or bakery and you've been shut down all this time, and you're not going to be able to turn the switch on and everybody start running back and doing everything as normal. I know I'm cooking more than I ever have. It is amazing to me how often I ate out now. I'm realizing it. And so I'm cooking more, and I probably will continue some of that. I'm going to be a little nervous to just go into a restaurant sitting next to a table with another person till we get a better handle on this pandemic. So there will be heated discussion about how much money we can afford to continue, and what not so much afford, but what we need to contribute to to the community to keep everyone alive, fed, and able to take care of their families.
Well, Congresswoman Lawrence, I appreciate that. I appreciate your honesty, too. There will be heated conversation and debate in Washington, but, there was on the CARES 1, and Democrats, Republicans, President all came together. I just want to let you know how important it is, because that's what I like about this show. We are totally on the front line talking to people every day. These stimulus checks do make a difference. I could tell you my own business, because I operate a business. This is just something I started up to do. I've got 20 employees, and we applied for the payroll protection plan, and because I have a relationship with a bank, I finally got my number today. So, I think I'm going to be okay. I think we're going to get our check, but there are a lot of, well, and I don't know yet. I mean, and I hear the funding is going to end tomorrow. So I was like, I didn't sleep last night because I got 20 employees. I want to make sure that they all continue to stay employed. I've not laid anybody off. We want to keep them working. And I read story after story after story of other businesses that are doing the same thing. And then the people that come on the show, they need the check. So I'm glad to hear that you guys realize in Washington that we do need this CARES too. A ton of people didn't get access on the small business side, the government, the post office, everybody else. So you think we're going to get there with that? You say there'll be heated debate. Do you think we'll get what we need?
Yes, it is. Right now, the debate is about, do we use our funds to keep businesses afloat? Do we use the funds to take care of the citizens with another stimulus check? So, that was the discussion last time, and we were able to come together and do both. And I think that is where we need to be. The crisis has lasted longer than we thought. And so we need to do both. We need to take care of the citizens. We need to take care of our business community. And so we need to do both.
President says that each state will, he talked yesterday in his press conference. We could talk about his press conferences for an hour. We're not going to do that. We're not going to do that on this show because we're just trying to solve problems. I don't want to create problems. But he said that, I hope we take him at his word. He said that, he's going to let each state determine when they open back up. Does that sound like a good plan to you?
Absolutely, because every state is not the same. So to give you an example, even within a state, let's take South Dakota. South Dakota has a hot spot in the state. And there's a large part of the state that there are no cases of a virus, of anyone being infected. So that's why it's important that every governor determine, because in South Dakota right now, they're trying to contain it so it doesn't spread. And that's the problem. When you just lift it and everybody's able to go back to business as usual, then the spread starts. Because, I'm going to go visit my friend. I'm going to go do this. And I'm a carrier. And then I give it to you. And then you go see your family and you give it to your family. That's the challenge. So every governor who has all the data should be able to assess how important it is and to have certain restrictions and how it's available to open up certain things. One of the complaints I heard about the governor restricting travel to your vacation homes in Michigan, when you get up north and get to the rural communities, they don't have a hospital every 5 miles like we have here. And our hospitals were overwhelmed. Can you imagine if so many people have homes up north and just prefer, with all this stress, to get away and go somewhere up north on some water? And we're carriers, and we start spreading it in those little small towns, that would have been devastating. And so thank goodness she had the wisdom to say, wait, everybody stay home, shelter in place.
Yeah, she's taken some, I get it. She's taken some heat for that one, Congresswoman Lawrence. She is taking some heat for that one. Do you see that we'll get to a point, maybe even before the summer is over, when we can go up north? I mean, that's what we do here in southeastern Michigan.
Yes,
we go up north. Hi, Dave Lorenz from Travel Michigan on. You probably know Dave. And he said, well, the one thing he said is we're not spending a lot of money promoting to the nation. So when we do come back, Michigan people need to travel in Michigan, and that makes a lot of sense. But do you see that we're going to be able to get in our cars and go up and spend a weekend on the lake?
I am so optimistic that we will be returning back to some form of normal, which includes traveling to our vacation homes up north. Just that we don't have to have a home. It's kind of tradition in Michigan that everybody kind of goes up north during the summer. In addition to that, I see a time where I'm so concerned about our children being out of school. Our children need to go back to school. I have a granddaughter who's in college. And so many of the parents are at home, and that has to happen because there's no child care. If the parents go back to work, there's no school and there's no child care, then that's chaos. So a lot of things have to connect before we open up the doors and get back to what we call normal.
Yeah, that's what is gonna. We got our hands full. You have your hands full. The governor has her hands full. The state legislature has their hands full. Our president has his hands full. We all got our hands full. This is gonna be. It was hard enough making the decisions to shut it down, but as I look at it, just one observer, Congresswoman Lawrence, I think it's going to be a little bit harder to figure out how to navigate the waters to open it back up.
It's not going to be easy at all, because just like the situation with the children, that was just a check the box because everybody's at home. It's your child, they're in their home. And this is another thing I'm working on is access to broadband, to internet. Pray that you had internet at home so you could still use the established curriculum to educate your child. But that's not a reality in every home. That's another issue. But the fact that we knew children were safe because they were with their parents was just one of those check the box. And nurse and daycare centers and nursery schools were closed as well. So now when we open back up and we tell people go back to work, where are the children going to be?
Yeah, that's tough.
That's just one of the questions.
It is tough. I want you to know, I know you already know, but I want you to know we've had virtually all of our superintendents in our area on the air over the past several weeks. What they're doing is heroic. They're feeding kids. They're continuing to maintain the education.
Yes.
Can you talk about, I know you know the stories. I know you've been talking to people. Can you talk about, just for a minute, and we'll let you go, but can you talk about the schools and the way they are stepping up to the plate in this whole thing?
The educators, there's never a vacation for the educators. So many children. The reality is the best meal of their day, and sometimes the only meal of their day, is in school, when they're in school. And so that was one of the things that we discussed and debated on the Hill. We have to fund food programs, especially for our children. So SNAP and other school programs, not only do we need to educate our children, we have to feed them. And so we did allocate funding to feed our children through school programs. And few people know that a lot of the schools have summer programs to feed the children when they're out of school during the summer. So we felt good about that because they already had a process and the ability to feed children when they're not attending school every day. So we infused more funding into that program so that the children could be fed. And it's the social challenges we have just been so amplified during this. Homelessness. Where do you, when you tell a homeless person to shelter in place, what does that mean? In Nevada, let me tell you how cruel it was. On the ground where homeless people sleep, they put markers of 6 feet. So, this is your...
Yeah, it appears we've lost our connection with Brenda Lawrence for just a minute. Congresswoman, we got you back. Go ahead. You're talking about Nevada. Start again, please.
Yes. I was saying, and the home, this is your 6 feet to sleep on the street. Homelessness, children being fed, our nursing homes, where we had to shut down communication, our lack of personal protective equipment. Who are these people that we're calling the frontliners? We've learned so many lessons in our social, sometimes insensitivity to those who people just walk by every day. It has become, when did we think a custodian in a hospital was a hero or shero? Because they're cleaning and allowing our nurses and doctors to be able to operate in an environment and our patients to be in an environment where they won't be contaminated. And right now, the custodians are one of our frontliners. And so we've had to learn some hard lessons during this period.
All right. Well, Brenda Lawrence, thank you very much for joining us. We are in good hands with you in Congress. I know you're working real hard. I know you care. I see you out in the community. You are out in the district an awful lot when we are doing that kind of thing. And I appreciate you taking all the time you took with us today. We don't ask political gotcha questions on this show. I am kind of curious, though. Can I ask one question before we say
Yes.
so long?
Yes.
Is the governor going to be our next vice president here in the United States? Think she's going to run?
Well, I know she is. She's rising in value. I can tell you that. She has been so impressive during this pandemic. She's shown leadership skills. But there's a lot of amazing names on that list, and she has said she wants to be our governor. But it's a chance of a lifetime. So I can tell she's a serious contender.
Yeah.
Before I leave, I can't
Yes,
leave
please.
without saying thank you. Thank you to everyone what you do, like the custodians cleaning the hospital, the UPS and FedEx drivers who are delivering medications and things to our home, the postal worker who we see every day. I want to thank the grocery store or the restaurants who are providing curbside, who are staying open to provide food. It's just so many thank yous. And thank you to Michigan for staying at home, for us fighting together by wearing our masks, our gloves, staying at home to stop the spread. I can't thank you enough. And I just want everyone to know that we will get through together. Mental health is very important to me, and I know this has been so hard on so many people. The deaths, oh my goodness. I know so many people who have lost loved ones. They can't have a funeral to grieve. They can't visit their loved ones to have that closing expression of love and appreciation for their lives together. That's life-changing. So we have a lot of work to do, but I want you to know I hear you, I see you. And for those who are stressing about getting to their home up north, think about those people who have lost their loved ones, who could not have a funeral, who could not even say goodbye to them. We got to start counting our blessings. The fact that you're healthy and you don't have this virus is something for us to focus on this time. And this sacrifice is short. It's short, but it's so necessary. So to everyone, please be safe. And I tell everyone, I'll see you soon.
All right. Thank you very much, Congressman Brenda Lawrence of the 14th District. Thank you very much. Taking so much time from your home here in the district. And very good to talk to you today on the Megacast. There she is. She took an awful lot of time for us. It's greatly appreciated. By the way, I didn't ask her that question correctly. I do realize the governor needs to be selected by Joe Biden. She can't really run, but it will be interesting to see what happens. And hey, bravo to everyone in our community who is stepping up and making things happen here. It's just been an absolutely incredible effort. We got a long way to go, difficult challenges ahead of us, but I know we will get there. Thanks again, Brenda Lawrence. We're going to take a break. We will be back in just a moment. You are listening to and watching the Megacast. Back in a moment.
Hello, I'm Dr. Faust, Medical Director for the Oakland County Health Division. Coronavirus disease 2019, or COVID-19, is a new disease caused by a new respiratory virus named SARS-CoV-2. COVID-19 was first identified in December 2019. There is currently no vaccine to prevent coronavirus disease 2019. The best way to prevent illness is to avoid being exposed to this virus. Wash your hands often with soap and water for at least 20 seconds, especially after going to the bathroom, before eating, and after blowing your nose, coughing, or sneezing. Clean and disinfect frequently touched objects and surfaces using a regular household cleaning spray or wipe. Avoid close contact with people who are sick, and avoid touching your eyes, your nose, your mouth. Cover your cough or sneeze with a tissue, then throw the tissue in the trash. Finally, stay home when you're sick. For more information about coronavirus disease 2019, go to oakgov.com/health or call 1-800-848-5533. Hello, I'm Dr. Faust, medical.
All right, well, we're sorry about the double PSA there. Hold on, let me hit one more button here so I can actually hear myself. My name is Dave Scott. This is the Megacast. Thank you for joining us all around our coverage area. We are having a little technical difficulty with some of our internet here. It is crazy how busy the internet is in the middle of the day. So if you're having trouble hearing us on some of our stations right now, we recognize that. We are working on it. If you want to be able to tune into the show directly, always go to Civic Center TV, civiccentertv.com. That is a great place to go, and you can catch the Megacast directly. So, wow, that was really nice. Representative Lawrence joining us on the show, Mayor of Pontiac, Mayor Waterman joining us earlier on the show, and a lot of other folks. Marcia Gershenson joining us on the Megacast today. All of them are appreciated, and their time is appreciated for joining us right here today. My name's Dave Scott. Tyler Keefe is running around. We might check in with him in a minute or two via Zoom. He is out of the studio today working on other things around the building. I want to thank you for tuning in to our program today, and it's awful good to have you. If you are online with us and watching, you can see that I'm on our website right now, and a lot of very useful information on the Civic Center TV website, civiccentertv.com. You can go to the coronavirus page, and that's where the top news headlines of the day are, the top coronavirus news headlines. I think the biggest headline of the day that we have published here is the fact that drive-through testing is going to begin in Oakland County, and that is going to begin tomorrow. There's a telephone number which we need to get up on our website, and we'll do so shortly after the show. The number is 800-848-5533. 800-848-5533. You can call that number if you are seeing some symptoms of coronavirus and you're in the Oakland County area and you want to go to the Oakland County Courthouse and get tested. Testing begins tomorrow morning at 9 o'clock. And you heard Marcia Gershenson from Oakland County tell us earlier in the show today that they're going to get those test results pretty quickly. They're doing the testing right here in Michigan in Oakland County. So we'll continue to get the information about that up on our website. Henry Ford Hospital West Bloomfield is circulating a new YouTube video celebrating the frontline workers, and why not? They've been doing a great job. New website helps answer questions about federal stimulus checks. You may have already got your check. You may not see it in your bank account. If you want to find out more, you can go to the link on the civiccentertv.com website that will take you to the University of Michigan's page, where they have created all the information you need to know to find out what's happening with your check. Now, it was interesting to hear Representative Barbara Lawrence say that she's going to be heading back to Washington somewhere about the 5th of May, and likely there will be a vote around that time on this second stimulus package that it could get you a second stimulus check, could help out businesses. We know that the Paycheck Protection Program that many businesses are counting on is going to run out of funds if it doesn't today, over the next couple of days. So another round of funding is expected, another CARES Act to be voted in or something, hopefully around early May. So we'll keep an eye on that. Other big news right here close to home, Oakland County is requiring essential workers to wear face masks, and that was the word we heard from County Executive Dave Coulter yesterday during his press conference. Story here says 22,000 Michigan citizens have been infected. In Oakland County, that number is less than that, but we have a lot of people infected. One of the most hard-hit counties in the state of Michigan and in the country, for that matter. So if you are an essential worker and you're working at a grocery store, as the picture on our website implies, it's not optional anymore. You need to wear that mask. And if you're an essential worker in any environment working in the public, you need to wear that mask, regardless if it's a grocery store, restaurant, whatever. This is an Oakland County rule. The rule also says that if you are an essential worker and you're not working in public, but if you cannot maintain social distancing, that you need to wear the mask. So that's all on the Oakland County website. You can find that. I'll go right up to the top of our page here. There's a link right here to CDC, State of Michigan, Oakland County. Go to the Oakland County link. They'll have the latest order and all the most current information from Oakland County. You can find that, and it is right there at civiccentertv.com/coronavirus. If you take a moment to go to the Megacast page, as we are doing right now on our Civic Center TV broadcast, you're going to find some of the clips that we have from the past couple of days. And one of my favorite stories over the past couple of days were these two teenagers, Jack and Sammy Pollock of West Bloomfield, who are students in the Bloomfield Hills School District, and they set up a website called Quarantine. And when we had them on the show yesterday, they discussed the purpose for creating this website to help other teens.
So what we really made this website for is to help people that maybe are an only child or have parents that work on a daily basis and don't really have people to talk to or to be around. And it's just a really good way to not only help people, but just to give people a place to go that they feel safe and someone to talk to.
Outstanding. Isn't that great? Couple of teenagers taking their extra time and putting together a website to help out. Deputy Chief of West Bloomfield Police Department, also on the show, he talked yesterday about the importance of opening the community back up, which we're going to be dealing with in the next several days and weeks. But Kurt Lawson of the West Bloomfield Police Department talked about doing that in a way that's safe.
Sometime relatively soon, we're going to have to open things back up, and how they decide to do that is going to be very important. Because like we said, everyone wants to get out of their house. They want to start going to restaurants and bars and golf courses and get in their boats. But we need to be really smart about this and really careful. We want to protect the economy as much as possible, but we really need to protect those people that are vulnerable, and that includes certainly our elderly population.
Police and law enforcement around our area have their hands full right now, not only preparing for what is to come, but also preparing and dealing with enforcing the current rules, regulations, and orders that have come from the federal government, the county primarily, in the state of Michigan even more so. And implementing those rules has been a little bit difficult, a little challenging. For the most part, people have been really good. And for the most part, when people have run astray of the rules, law enforcement, when they have interacted with them, have for the most part, offered friendly reminders rather than enforcement and tickets. And I think West Bloomfield said they haven't issued any tickets. We saw in some of the media accounts, sheriffs around the state of Michigan have been offering tickets for boaters and people that have not been following the rules. But for the most part, if you're behaving, or if you make a mistake and you get close to somebody, if you are reasonable about it, then you're not going to run into trouble. I saw some photographs online, maybe you did as well, of crowds at Sleeping Bear, a national lakefront up in northern Michigan, the Sleeping Bear Dunes, and the pictures that are online, I think they were on M Live today, show big groups of people all together, and I mean, that's just wrong. Yeah, that doesn't make any sense at all. So they, unfortunately, as a result of that, closed down that national park, and that's a national, not a state park. But, you know, that I'm just reporting what's going on out there. Back to our website. We talked to Debbie Binder, the West Bloomfield Township clerk, yesterday. And we have an election coming up in May. And traditionally, the workers that have worked at these elections have been people that are retired. And taking a bunch of retired people and encouraging them to volunteer to work in public right now, you can understand as a challenge. We talked to Debbie Binder yesterday briefly, and we asked her about the impact the coronavirus is having on the upcoming elections.
So a lot of it depends on what orders and what legislation comes forward. We're anxiously awaiting that, but we do need, whether or not we have this situation now, we do need to engage the next generation of election worker. That being said, they're not lining up out the door to come work elections right now in this climate. So we're doing the best we can. Any helping, get that word out you can do would be greatly appreciated.
So that's exactly what we're doing. So if you're a teacher, if you're a student, if you're one of the administrators in one of our school districts, I know many of you are tuning in, and you think that you've got some students, maybe in some kind of a class, might be a good class project, maybe just a bunch of civically minded students that want to get involved. Why not have them get involved in helping with the upcoming election? What a great civics program that would be. If you want to get in touch with Debbie Binder in West Bloomfield or any of the other clerks around our service area, call us. We'll hook you up, or just call them directly. But I think it's a great idea. Get some students involved. You don't need to be of voting age to work the polls. I think you might need to be 16. There are rules about that. We talked to Debbie about that yesterday, but what a great idea right here. Again, another thing you can do right here locally in our community to help out. And a positive experience can come out of the whole thing, all right? So we are going to take a quick break. My name's Dave Scott. This is the Megacast. Thank you very much for tuning in. We are on great radio stations around Oakland County, including WAHS 89.5, Avondale Community Radio, 88.1, WBFH, The Biff, 89.3, Lakes FM. Thank you very much for tuning in there, and of course tuning in on Civic Center TV. For those of you watching, I'm going to hit a couple of buttons over here, and we will be back in just a moment.
Hi, I'm Dr. Jonay Caldoun. We know that COVID-19 is spreading rapidly across Michigan right now. The most important thing people can do to protect themselves is social distancing. That means unless you are a critical infrastructure worker or going out to get food or medicine for your home, you should be staying at home. Stay home, stay safe, save lives.
All right, more of the Megacast coming up in a minute. I'm just going to do this live on the radio. I'm going to cross my fingers and hit this button and hope this is a different public service announcement. It isn't. It's the same one. See, I was worried that was going to happen. Let me try this again. Thank you for putting up with us. I'm the only one in the studio. And because we don't have all of our engineers here, we're doing the best we can.
The Centers for Disease Control and Oakland County Health Division encourages households to prepare for the possibility of a coronavirus outbreak in their community. Keep extra items in your house for an extended stay at home. Remember any special food items for babies, the elderly, and pets. Keep non-prescription drugs and other health supplies on hand, such as personal medications, at least 1 month's supply, first aid kits, alcohol-based hand sanitizer, at least 60% alcohol, non-mercury thermometer, and get copies and maintain electronic versions of health records. Talk with family members about how they would be cared for if they got sick and what would be needed to care for them in your home. Learn about the plan at your child's school and your workplace. Discuss sick leave policies and/or telework options for workers who become ill. For more information, go to oakgov.com/health or call our Nurse on Call hotline at 1-800-848-5533.
Welcome back to the Megacast, 89.3 Lakes FM, lakesfm.com, civiccentertv.com, Civic Center TV, Channel 15, Channel 99 on AT&T, and, of course, on our radio stations. Lakes FM 89.3 in West Bloomfield, 88.1 WBFH, The Biff in Bloomfield Hills, WAHS 89.5 Avondale Community Radio. He's been in the studio with me up to now, but there he is. He is on Zoom. Zoom it in. Hey, Tyler Keefe.
Hey, Dave. How are you doing?
I'm doing fine. What a day. Wow. We had just spectacular guests who had an awful lot to say. I just had to get out of the way and let Marcia Gershenson say her thing, our county commissioner, Deirdre Waterman, the mayor of Pontiac, and then how about Brenda Lawrence from Congress, spending just an enormous amount of time with us. And I thought a lot of really interesting information and insight from our elected officials.
Yeah, it was good to get an insight from elected officials from all across the board, really. We had local officials. We had, of course, in Pontiac, which is a hard-hit area during this, Oakland County, getting the county perspective. And it was really interesting for the first time we got a perspective from our federal government, from our U.S. representative, a longtime U.S. representative, to see what they're doing. It was good to get a full scope understanding of what government's doing to support the community and to support businesses and people that are really in a tough spot right now.
Well, no question about it. And I thought Brenda Lawrence did a good job of thanking everybody. I think she really did. And in addition, she, shared with us vital information about the next CARES vote, which is coming up in early May. I don't think we've really heard that from anybody else. We talked, of course, about the challenges in the African-American community with the coronavirus and making sure that we began to collect the metrics. That was the theme throughout the show today. So lots of good information. Tomorrow, this is all yours. Tyler's going to host the Megacast tomorrow. I will be out on assignment, as we say in the biz. You ready?
I'm ready. I'm excited to do it. It's been a while since I've done a solo hosted radio show, and I always enjoy hosting radio, and especially news during this particular time and the service that we're providing to the community. I'm honored to do it. I'm happy to do it. And I'm really excited.
All right, well, you're going to have to trade in your millennial outfit that you have on today.
Of
course. Can you like put the tie? I mean, I've been wearing a tie. You you got the ties? You got a good tie selected for tomorrow?
I do. I have an outfit selected tomorrow, just especially for the show.
Do you know what you have lined up for tomorrow? Or are we still working on that?
We're still We're still working on a little bit of it at this point in time, but we are going to be speaking with Chief Greg Flynn tomorrow, and we'll be with the West Bloomfield Fire Department, talking to them about something that they're doing actually today, a solidarity lap at.
I don't think we want to talk about that. Can we talk about that publicly? Is that a secret? Well, it doesn't matter now. So we'll.
I guess I let the cat out of the bag. I don't know that it's necessarily an open event to the community, but it's something really nice that the fire department and the local first responders.
Yeah, the fire department will be saluting our healthcare workers today, and we'll have more. We're going to be out there. We'll cover it in our own safe way, and Tyler, you'll have information on that tomorrow, I'm sure, right here on the Megacast. Any other thoughts today? Just anything you're seeing? Any comments about what's going on the coronavirus front?
Nothing really all too new from my end. Just people are struggling, and it's good to see that we continue to have businesses like we had Mr. Forsyth on earlier from Detroit City Distillery, seeing that businesses are doing their part, that civilians are doing their part, and that the government's doing their part, because we are working through this together. We've never in our lifetime experienced something like this. This is something that the last time our country and our world really experienced a pandemic of this kind was over 100 years ago. So this is a once in 100 years.
So if given that long, it wasn't even in my enormous lifetime either. So
it wasn't.
Oh. The one thing that I got out of the show today that I'd just like to share with people, as we say so long, is just the challenge. I just think we have a real challenge in front of us, and we've heard from almost everybody. We can't hide from the fact that going on right now in Lansing as we speak, there's a protest. I've not been watching the news, but it's probably a significant protest, and that's going on, Tyler, as I look at our website here. There's a lot of folks that aren't really happy with the governor's restrictions that she's put in place. It's starting to get harder on people. And I got 10 seconds for you, but, it's just going to be interesting to see the job that we do as we come out of this thing. That's going to be the hard part. I think it's been hard doing what we've done so far, but as we try to come out of this thing, that's going to be tough. We have tough decisions ahead of us.
We do, and I think the governor and everyone else involved is doing their best to take the information that they have and do what's best for the community. And as we come out of this, we need to do the same on each individual level.
All right. Well, thank you very much, Tyler. I appreciate your efforts today. It will be Tyler Keefe solo tomorrow on the Megacast, working a little bit better in our studios, doing this one at a time. So we salute the great job Tyler's been doing behind the scenes on the show each and every day, and absolutely look forward to him being with you here tomorrow on the Megacast. So thank you very much for tuning in today, and a big thank you to all of our guests who have been here today in the program, and you for tuning in. Want to thank the West Bloomfield Police Department, who was kind enough to put us on their Facebook page today, and that worked out really great. We're able to reach an awful lot of people that way. And thank you very much for tuning in. We invite you to stay tuned throughout the day. This program will repeat on many of our outlets, and if you want to see excerpts or go in and look at the videos that made up today's show, you can go back in and just watch one interview or another. They are all at civiccentertv.com. Go to the coronavirus page and you'll find the breaking coronavirus news, links to the municipal contacts that have all the information that you need, and much more. And then go to the Megacast link. You can go there and actually hear the program if you want to do that, or go back and hear any of the interviews that were broadcast earlier in the day. Thanks to Lakes FM 89.3, 88.1, WBFH The Biff, and WAHS 89.5, Avondale Community Radio. Thank you for being a part of the Megacast. We'll talk to you next time.